Bruce Rivey has 15 wind turbines within a mile of his home. In 3 months, he and his family say they've hardly heard the turbines and can't report any health problems. In fact, he'd gladly accept more in his neighborhood.
We'd certainly wouldn't have any hesitation at all if there was more that came to the area.
Ask the same question to Sandy McLeod and you'll get a completely different answer. The local school teacher hasn't had a good night's sleep since wind turbines came online near her Ripley area home 17 months ago.
Until we know exactly what's caused the problems, and these problems have been fixed in the turbine projects up to this point, and they should not build another one out there.
Dr. Robert McMurtry couldn't agree more. He's been following the very rapid wind energy expansion across the province.
There are lives being put in harm's way. There's no question in my mind about that.
McMurtry is the former Dean of Medicine at the University of Western Ontario and is currently an orthopedic consultant. For months now, he's been studying the medical reports of people who say the turbines are making them sick.
Apart from that, I just was called by another person today whose heart arrhythmia, something called atrial fibrillation, goes out of control when she's near the wind turbines.
That sounds a lot like what happened to Sandy McLeod this February when she had to go to the hospital with heart attack symptoms, something she blames on the turbines.
We're having a lot of trouble, and we would like it to be over.
So too would Glenn and Brenda Wilds. They've left their home amongst the turbines for the relative calm of a townhouse in Kincardine. They're happy and healthy here, but the headaches they got at their old home were simply driving them crazy.
I don't really think I could live in there anymore.
But they did the test for the bats, they did the test for the birds, but I don't think they did any study for the humans. And it's very hard to get people convinced to believe us.
Near Ripley, Scott Miller, A News.